like they say, put the oxygen on you when you get on a plane first, and then you'll be able to take care of other people. That's the same thing. We have to realize that we have to take care of ourselves, and when we need help, we have to say help.
Hello, everybody. Welcome into BGV Conversations. We are back with another episode. Today is so special. We have a beautiful, an amazing, an educated Black woman who is going to grace us with all her knowledge, a graduate of Southeastern University, McNeese University, as well as Southern University, receiving her PhD, Dr. Cynthia Bienemy. Welcome in.
Thank you very much. Thank you. I'm happy to be here.
Thank you so much. We're so happy to have you. We're so happy to have you. So we're going to dive into it because we want all the folks to know all of your knowledge. So I'm going to ask the first question. First and foremost, tell us about yourself, your education, and your career, and what inspired your journey into medicine.
Ever since I was a little girl, I've always said I wanted to be a doctor. You know how they would everyone would ask you, what do you want to do when you grow up? And I said, well, I think I want to be a doctor. I want to help people. And of course, there were, members of my family, my grandparents, my mothers, my aunts, they all would go to the doctor and I'd hear words like high blood pressure and things like that. So as I grew up, of course, I'm from a neighborhood that some people would call the hood. But in that neighborhood, we had, there were many people that we were in a community that loved each other, that looked out for each other. I went to schools in the neighborhood that were all predominantly Black schools with predominantly Black teachers. And it was exciting to see that some of these teachers, many of them were really raised in similar neighborhoods or in the same neighborhood. The church that I went to, that I grew up in, there were teachers and my guidance counselor actually attended that church. So it was exciting to see others that looked like me, that were very passionate about education and that had actually had gone to college and completed college. And so they were inspirational in making a decision to go to college and to really pursue becoming a doctor. So I ended up getting a scholarship to Southern University. And so I was going to go pre-med there. And then after a couple of years, when I realized that there were no medical schools here in Baton Rouge, that the closest would be New Orleans. And then that was not a guarantee. And I didn't feel like I could leave home at that time because felt like I needed to be there for my mother to support her because, in all honesty, we lived, my daddy, physically and mentally abused my mother. And it was not on a daily situation, but it was not a wonderful home life to have. And so what I decided to do is I'm going to become a registered nurse. That would be the next best thing. But looking back, that was the best thing. I believe God was ordering my steps even then. And so I knew I wanted a degree. And so, because I don't know if everyone realizes it, but it's 3 ways to become a registered nurse. It could be through a diploma program, which is usually through a hospital. It could be through an associate degree program, which is usually through a community college. Or you can actually get your bachelor's of science in nursing, which is through a academic higher education college, university. 3 ways.
I did not know that it's 3 ways. I thought it was just like the 4 to 6 year process and everything. I didn't know it was like a three way type of thing. 3 ways, and that's confusing to the layperson. But back in 1980s, when I was in school, there was discussion about the Bachelor of Science being the only way to become a registered nurse, but that discussion has been going on for years. But anyway, I went to Southeastern, the first time I had ever been to a predominantly white school. How was that, being like the minority?
It was interesting. It was interesting, but I'm one of those that I tend to stay focused. And I commuted back and forth from Hammond to Baton Rouge.
Okay.
And so I would go like 3 times a week. I would be commuting with a friend of mine who actually, she was also an African-American, and she was married and had 3 boys.
Wow.
But
college?
Yes, in college.
Wow.
But she was a licensed practical nurse.
Okay.
And Des was one of those persons that knew what she wanted, and she was determined to do whatever she needed to do to get it. And so that was inspirational too. So we commuted back and forth to Hammond, and the instructors I felt were kind enough, but you never really felt like you were part of the student body. And that may have been part on me because I went there to do what I needed to do, to accomplish what I needed to accomplish, to come back home because I was working at the same time, working at Winn-Dixie as a cashier. And so in doing that, I didn't have a lot of time to spend on campus and in campus activities, but I worked very hard. And
it
so
shows. She has her PhD, y'all. It shows.
and what they said is when I graduated that I was 0.01 points from being the number one student graduating that semester out of the nursing program.
By points?
So, by point, less than 1 point. Less than 1 point is what they said. And so that was, but I really believe with all my heart that going to the community schools where I had instructors that looked like me and that were passionate about education and they saw something in me. And then even going to Southern University for 2 years for that pre-nursing and the compassion. And if you just show that, if you would show them that you were interested in learning and doing the work, they would just engage and bring you closer. And so I think that truly prepared me to be successful at Southeastern. It really did.
It's definitely something about a community that supports you and uplifts you.
Absolutely.
And, just helps you. And so we appreciate you for all that you do for the community.
Thank
you.
I
just want to get into the next question. What do you see as the biggest health challenge facing Black women today?
Well, there are specific health conditions that when you look at the stats as it relates to cardiovascular or heart disease, that there are more Black women that are diagnosed with cardiovascular and heart disease than are white women, and that more Black women die from cardiovascular disease. And some of the risk factors associated with that is high blood pressure. And when I was in graduate school, I focused my thesis on high blood pressure in African-American women. And I did a little activity, a program at my church, talking about the risk of, healthy eating and exercise and controlling stress, all of those things to help decrease your blood pressure. And at that time, it was about 58%. The stats said that 58% of Black women in the United States had a diagnosis of high blood pressure. Well, for my dissertation, I built on that research, and I really took a close look at chronic stress in African-American women and also spirituality and how it impacts high blood pressure in African-American women.
So but stress,
chronic stress.
So when I think of blood pressure, I think of salts or something like that. So it can be stress that causes it as well.
Absolutely. Really, the research has shown that the cortisol, which is produced under high stress levels, increased cortisol tends to wear your tissues down.
Wow.
And so it's one of the, there's a new term that they call weathering, that with chronic stress, that many times in African-American women, because I even measured stress and had another scale that actually looked at stress that many African-American women, especially single women, experience, is that sometimes we are so used to this stress, we don't realize that, this is stress. This is not normal, but yet it's still having that impact on our body. So there's a big correlation between high blood pressure and chronic stress. Matter of fact, in the literature, you may have heard a lot talked about the social determinants of health. And social determinants of health are those non-clinical things that impact a person's health, like food insecurity, not having enough food to eat, not having a safe place to live, lack of education, all of those non-clinical things, and stress, and bias in healthcare and racism, and all of those things impact a person's health. So it has nothing to do, a large percentage, which is 60%, about 60%, has nothing to do with what a person eats, or if they're adhering to their medication, taking their medication. But there are outside forces that really impact a person's health, especially African Americans.
Wow, this is like all coming together. It's like a click in my head, because I suffer with anxiety for a second, and my therapist would be like, "You have situational anxiety. It's not something like that's going on. It's like when certain situations happens, it brings you high stress, and that's what causes the anxiety or the sickness or what have you." So I think that is like a click in my head for sure, because a lot of things are caused from stress or feeling like you don't have enough, or you're not good enough in some workspaces because you're a Black woman or something like that. So that does make a lot of sense for sure.
And it definitely does. I mean, research has proven that has an impact on your physical health, not only your mental health, but your physical health as well.
Wow. So I know that you're an advocate for heart health, and you just stated 58% of Black women at what point, African-American women
have a diagnosis of high blood pressure.
And that's still current to this day, 58%?
And that's the thing. Throughout each level of my education, those stats are still true, that over half of African-American women have a diagnosis of high blood pressure. And high blood pressure is also known as a silent killer, because we can be walking around and not even realize it's many people will say, well, I have a headache or I feel dizzy. But by that time, it's probably so elevated, they're on the way to having a stroke. So, having your numbers checked, and we'll talk about it a little bit later, what we need to do as individuals as well as advocating for our health. But yes, high blood pressure is a risk factor, even diabetes. African-American women have a rate of diabetes higher than white women do. And looking at diabetes and high blood pressure, they're all a risk for having an impact on our heart health. So it's so important for us to, be aware of the basics, and then also to keep up with our numbers.
What are some early signs of diabetes, kidney disease should we look out for as Black women?
Well, with diabetes, it's may experience a lot of thirst, and you may have to urinate a lot, and you might even get a funny taste in your mouth, or you may start feeling dizzy. So, but keeping in mind that many of those symptoms are related to other conditions as well. So whatever your body is telling you, hey, this is not my norm, then that's where you need to be an advocate for yourself and seek help, seek some assistance. But when you go with that, you can make sure you can bring your numbers with you. What is your blood pressure? And you may not have a blood pressure machine, but they are available in the stores where over the counter. You don't need a prescription for that. Or you can even go into CVS or one of the pharmacies, and they have the little machine that you sit there and you can take your blood pressure. But, with diabetes, with kidney disease, they're all related. So you may have maybe going to the restroom, urinating a lot, even with kidney disease. But a lot of time, once those symptoms start, you're already pretty much into having that diagnosis. So they have something that's called pre-diabetes. And there's a certain number, the number for glucose is 80 to 100. But then now they have what they call the hemoglobin A1C, and that should be less than 6.5. Well, some people will go to the doctor for the initial time, and they may have a hemoglobin A1C of 8.1. That's extremely high. Yeah. That's extremely high. So what we need to do is really, whenever our body is telling us something, whenever we're doing things that, such as feeling dizzy or having headaches, in the back of our head, or if we're not lose our appetite, or if we, just any number of things that this is not the norm for me, then it's your responsibility to get a check. I think we have to take some responsibilities. There are a lot of outside sources, like we talked about, social determinants of health. Yeah. But in the reality is that we have to also take responsibility for our health.
Like, you brought me back when you talked about the machines in Walgreens and CVS. I remember when I was a kid, I used to playing with it, not knowing what it is. And even still to this day, when I go to the doctor, they do the testing and everything like that. And I have to ask, I'm like, is that good numbers? Like, is it bad numbers? So what would you say would be a good, blood pressure number?
Now, ideally, the textbooks would say 120, and that's that top number. They call that systolic number, over 80, which is our diastolic. So 120 is when our heart is pumping. And then between each contraction, then there's relaxation. That's the diastolic. That's when your heart is at rest, that bottom number. Okay. So when those numbers go up, that means that your heart is having to work harder in order to pump blood throughout your body. So that's, then some say there are some sources out there that say 130 over 80, but anything that's over 140 systolic or over 80 diastolic, you need to be aware of and say, hey, I need to see about checking those numbers. And what you said about going to get your blood pressure checked, that's something else. And I really want to inform everyone that we have come into a healthcare system where everybody's wearing scrubs. And many times you don't know who's who. You don't know if it's a registered nurse or if it's a licensed practical nurse or if it's a medical assistant taking your blood pressure. Mm-hmm. And to be very honest with you, everyone does not do it the same way. I went to the doctor recently, and I believe it was a medical assistant, and she was taking my blood pressure, but at the same time, she was asking me questions. That's not what you do. You're supposed to sit quietly with your feet on the floor and your arm at heart level, and that's how you're supposed to take your blood pressure. So I think everyone should be aware that, don't be afraid to ask, now, are you a nurse or are you a medical assistant? And then when they tell you, you ask for the numbers. Don't just say, it's good. Don't accept it's good or it's whatever. I want the numbers.
I'm so quick to say, is it good? That's good. Okay, good. Let me move out my way. So I want to do more research and learn more about the numbers so I can actually know like what's going on. Because if I get close to that, what you said, 140 level, 142, I need to know like, this is not so good. I need to see what's going on here. I need to see if it's what we talked about earlier. Is it like my stress? Is it the food I'm eating? So definitely need to like research more. And if you're out there and you are one that goes to the doctor, shout out to people that go to the doctor. We need our doctors. We need our nurses. We need everybody who's in the medical industry for sure. But I say, make sure that you are actually educated on what they're talking about, not just getting a good, like she said. So, yes.
And now that we have, what do we call the electronic health records, and I don't know if you're familiar with MyChart, different healthcare systems have. I've actually spoken with some people and they say, I don't use that. But that's where everything is documented. When you go and visit your healthcare provider, be it a nurse practitioner or physician or whomever, there's information. They're putting information in your health record. That's your health record. Yeah. And you have access to that. And so you can, and even your lab work, when you have lab work drawn and it shows a trend, people say, I don't know what that means. Okay, you don't know what it means. But then take on our responsibility to find out what the basics. Find somebody. Everybody has a nurse in their church or someone that, and now we have access to the World Wide Web, Google, and even in finding really good sources of what is the average, what's the normal glucose reading, or what's the normal hemoglobin A1C. And I know many people say too much information sometimes, and I agree, but I think we have to learn to educate ourselves so that we'll know what questions to ask when we go to the doctor, because many times we'll go to the doctor, the nurse practitioner, or whomever, and not have any questions written down, nothing, just accepting whatever they say. And you have to see those, they're very busy and they're seeing hundreds of patients. And so you're one of those many hundreds of patients in that day. So you're the main advocate for your health. They may not be the one to be the advocate for your health.
That is good. Y'all heard that. Get your notepads, get your phone. There's notes in your phone. Write it down. Make sure you have your questions for your doctors. Make sure you have your questions for your nurse, because you're the only person that can advocate for yourself. And speaking of advocating for yourself, what do you think is the best method for Black women to advocate for themselves as far as their health goes?
Well, first of all, I think it's important for Black women to realize that their body, and my faith means so much to me, but your body is the temple of God. So focusing on your health is important. It's very important. Many times we think about, what do our children need? What our family need? What are, I need to go to work and I need to clean the house up and I need to go and make grocery. And we say make grocery here in the South. My children even kid with me about that. But, have to cook and provide for my family. And all that's very important. But like they say, put the oxygen on you when you get on a plane first, and then you'll be able to take care of other people. That's the same thing. We have to realize that we have to take care of ourselves, and when we need help, we have to say help, because we've talked about the role of stress. And a lot of times when we have stressful situations, what do? Sometimes we have that comfort food. We might get that pint of ice cream and just sit in front of the TV and just eat the whole pint of ice cream, or the salty foods, which is not good for us. We may go, and what's easier to get? I'll go run and get some chicken, or I'll go run and get this or whatever.
Some Popeyes.
Yes. So, we have to recognize that we have to take care of ourselves. We have to be careful of what we eat, not staying away from salty foods and the greasy foods. Now, mind you, my parents and grandparents, my mother and my aunts, they cooked and they knew how to cook, they threw down. But as we know better, we do better. And so I never tell, people to stay away from that 100%. No, I'm saying, hey, you know your health better than anyone else. So stay away from it. And on special occasions, go ahead and eat that macaroni and cheese. And you may go get that piece of, Popeye's chicken or whatever, but that can't be your daily life. Yeah. So, and then exercise. Many times, we don't want to exercise. We just want to, I've worked all day, I'm tired. And I understand that that's real. But finding time to exercise, you don't have to belong to a gym. What they recommend is 30 minutes, 5 times a week, doing that exercise. And you can at church, we get excited and we're praising, worship, and we're dancing. Well, you can do that at home. And now you have YouTube. And so you can find you some exercise videos and get out there. You can get you some cans and put them in your hand and exercise your arms.
Come on, weights.
So, there'll be your weights. So get your children involved in it. It doesn't just have to be you, because you're setting the example for your children, but those are some of the kinds of things. So be mindful of what you're eating. Be mindful of sedentary lifestyle, that you need to exercise. Drink plenty of water. Many of us don't like water, so find ways. You might want to add a little lemon in your water. But we need to take in the water, and also be mindful of exercise. Be mindful of stress. Yeah. And that's somewhat of a we say that's easy, that coming out of our mouths, but it can be very difficult depending on that person's life. We really don't understand the impact that it truly has on our health. And so when we're addressing stress, there's basic things that we can do. We can learn how to just stop and rest a minute and take deep breaths. There are some things that, in terms of, like we talked about, the social determinants of health that have an impact on our bodies. We talked about not having enough food to eat, not having the money to pay our bills, not having a job that really helps to take care of our family the way we want to take care of our family. So all of those are stressful events, life events. Yeah. But in the midst of those life events, we have to learn, because they're having an impact on our bodies. So we have to learn other methods that we can use, healthy methods that we can use. And sometimes it's just sitting down and maybe reading a few scriptures. Maybe it's just sitting down, taking a deep breath. Maybe it's just partnering with a neighbor and saying, okay, you watch the kids this Saturday, I'll watch the kids next Saturday, and taking some time away and just calming your body and calming your mind. So we have to find innovative ways in order to deal with stressful life situations that sometimes otherwise we have no other control over those stressful events in our lives.
I know that you're not just being a registered nurse like you are all the time. You are also out here in the community impacting lives, and you have whole woman health, talking about mind, body, and spirit. And so tell us more about that. And we definitely want to hear about what you do for this and you being the boss that you are, a CEO and all those things. So,
well, one thing that I really think is so important. I've had the opportunity throughout my career to really serve in many positions. In my clinical experiences, I saw so many people that looked like me sitting in waiting rooms for hours at end. Mm-hmm. And so working in that environment, I had a desire that I wanted to work there because I wanted to let those people they were valued. Yeah. You know, they were just as important as someone going to the private hospital, and we want to give them quality care. Well, that's the same thing when I left there and I went to education, and I actually taught at Southern University in the School of Nursing. Okay. And, you know, just having the ability to learn and to work with young people and hopefully impacting not only their skills and their knowledge, but also the compassionate care that is needed. And then in research, I've had the opportunity to do research and also to serve in leadership roles. I was first director of the Louisiana Center for Nursing, which was our workforce center at the Louisiana State Board of Nursing, and to really look at the data. And that's where I really became excited about looking at the diversity of our nursing workforce. And just here in Louisiana, only 18% of our RN workforce is Black African American.
18%.
Only 18%, but yet we have about 33% of our population is Black African American. Wow. So, you know, so those kinds of things. And the research has shown that having healthcare providers that look like you, that come from a similar culture, that can better communicate with you, that it does have an impact on health outcomes, because we tend to, you know, feel to trust those individuals more.
Absolutely.
And so that's why I've become so passionate about increasing the diversity of our nursing workforce, and we'll continue to work with that. Matter of fact, I just came from New York. I was inducted into the Academy of Diversity Nurses in Nurse Leaders. And so I'm excited about that, and it joined other nurses from across the country, nurse leaders that are working on the diversity of our nursing workforce and increasing diversity of our nursing workforce.
Congratulations.
Thank you.
Congratulations.
So in doing that, you know, I just have a love of the community. I've sat at the tables, I've listened to the conversations, and sometimes there's no changing of minds. You know, you can present the data, and sometimes individuals with other mindsets and maybe of the majority race, they'll indicate that they're interested, but then when it's time to put the money into our communities where it's needed, it may not be put there. So at this time in my career, I'm really interested in sharing knowledge, information about advocacy, and our faith, and how those three things go together. Yes. So as a result, when I've been, you know, asked to give presentations to at various churches, and so with that, for Black women, I've developed a handout that is centered around what is it that we can do on a daily basis to better take care of our health. Yeah. And one of the things, keys to caring for God's temple. You know, this is God's temple. Pray daily. Mm-hmm. I personally start every day with prayer, you know, and depending on what your schedule is, and it doesn't have to be that you're reading a book of the Bible a day. It could be a scripture that means something to you that's going to guide you through your day. And then rest well. Many times we don't understand the power of rest. Rest is essential. You know, they say at least 8 hours of sleep every night, but resting your body allows your body to heal. And so,
I need to hear that.
Yes.
Because I do not sleep. I need to sleep more. Yes. I need to definitely sleep more for sure. So this is for me.
Because it really does make a difference. It really does make a difference. And then listen to your body. We've talked about that before. Listen to your body. You know, if something's going on, you know your body better than anyone else. As a matter of fact, I was just speaking with one of our church members that, you know, she had gone to the emergency room because of something going on with her foot, and it was swollen and there was an ulcer there, but they said, well, everything checks out. It looks good. They didn't give her any IV antibiotics. So 2 weeks later, and since then she's seen multiple doctors in between. And then she shared with me that just, I think on last week, she went, and finally the wound care healthcare provider looked at it and said, you are not crazy. This is not good. And they had to they opened it up and drained infection out of it.
Wow.
And so what I share with her is I applaud her courage to continue to advocate for herself.
Yes.
No matter what anyone says, if you know this is not me, this is not normal, because if that infection had not been drained, could have easily got into her bloodstream and caused her to be septic. And so, which is a critical situation. So I think, knowing your body and listening to your body is important.
Yes.
And eating wisely. And we've talked about staying away from the fried foods, the salty foods, especially on a regular basis. Every now and then, your portions mean a lot, Many times we want to eat and say, oh, I can't move, but no, we have some control over that. So again, and then move faithfully. Exercising is important. Finding some type of exercise, and you don't have to join a gym. What I've been doing lately is and there's so many parks around the city, around the state, that I'll go in the morning and I'll walk 3 miles, maybe 4 times a week. And now it's gotten cold, so we have a little treadmill, and so I'll get on that treadmill. Yeah. So I'm trying not to come up with excuses of why. Now, do I enjoy? I pray about that. I say, Lord, please let me enjoy getting on this treadmill or going for this walk, because I'm not one that enjoys that. I've heard people that say, well, I could just get so much energy, out of exercise. And that's great for them. Maybe one day I'll do that. But I do it because I know I need to do it for my health. And so we have to do those kinds of things.
Yeah. Speaking of energy, what would you say is like missing within Black women as far as like the vitamins and supplements that we take that we need for us to have like the energy that we need?
Well, I think one of the things is that we don't know what we're lacking. I think that's one of the keys, is that many times we'll go shopping for vitamins, go to the Whole Food store someplace and read, but we honestly don't know what it is that we're lacking. And there are actual blood tests that can tell you, if you're low in vitamin B12, if you're low in vitamin D. And vitamin D is just something I think that every Black woman should be aware of. That, I think it's the stat says over 80% of Black women are low in vitamin D. Mm-hmm. But something that I learned just a couple of weeks ago is that vitamin D without K is, that the K actually helps your body to absorb the vitamin D better. But then I did a little bit more research on it, and I found that, that it also helps the calcium not to go adhere to the arteries. Mm-hmm. Which means that, hey, it helps with heart health as well. Yeah. So I think, even if your doctor, many times the doctors this may not be a routine blood test, but you advocate for yourself and you say, I'd like to know what my vitamin D level is.
Yes.
Or I'd like to know what my vitamin D12. I've been feeling tired, and I understand that this goes along with that. So I think, knowing, what you're lacking, advocating for yourself, and doing the research on what's the best vitamins. And of course, we have Black girl vitamins, which I've heard that are excellent. Yes. So I think that taking vitamin supplements, especially if you're not taking in you're not eating properly, is very important.
Yes, ma'am. Yes, ma'am. Thank you for that. And I know we have a few more questions. I'm going to just dive into this one because this one is so important, especially for women. Is it true that Black women face the highest maternal mortality rate?
Absolutely.
Can you tell us why? Like, do you know?
That's across our country, and that's here in Louisiana. And I've actually attended task force meetings where they've discussed it. A lot of it has to be with bias in our healthcare system, not listening to Black women that are pregnant. A lot of it has to do with Black women not receiving the proper prenatal care. And making sure that when you go to the doctor, that you have questions, that you ask the right questions as it relates to okay, what are the symptoms? If I'm having headaches, is that not a good thing? No, that's not a good thing. If I'm having dizzy spells and I'm pregnant, what's going on with me? Not just accepting, oh, well, you're going to be okay, because there are biases out there. Your blood pressure may be elevated, but then I've heard stories where the healthcare provider said, well, most Black women's blood pressure is elevated. But no, if you have an elevated blood pressure when you're pregnant, that means something, And so sometimes, again, being an advocate for yourself. But we think that not listening, that matter of fact, just something happened in November. I'm a member of the National Black Nurses Association, and they put out a position statement. But I'm not sure if you heard, I think this was in Indiana. I think she may have been 38, I'm not sure, but I had come to the emergency room and she was pregnant and she felt like she was in labor. And the nurse told her, well, no, you're only 3 centimeters, so you need to go home and, and then come back later. Well, her husband left the hospital. It was, I think they said 8 or 12 minutes later, she delivered the baby on the side of the road.
I saw that.
Yes.
Oh
yes.
my gosh.
Again, not listening to, you can't treat everybody as if they're textbook.
Yeah.
You have to listen to the person. And then there was another incident in Dallas, Texas. And the person, and I actually saw the video, the person in the wheelchair, and they're in tremendous pain. Black woman, pregnant woman in tremendous pain. And she was being asked admission questions. And I think she had someone else there with her that could have answered those questions.
Yeah.
But the nurse continued to ask, I'm saying the nurse again, whoever this is asking her these questions, basic kinds of questions, but she's in extreme pain.
Yeah.
Instead of taking her back to be examined. And I understand that maybe 12 minutes she was back there and she had the baby.
Yeah.
So she could have easily had the baby in that admit area.
Yeah.
So those are the kinds of things that, you want everyone to be treated with kindness, compassion, and receive quality care. It's not just Black women, but what we're finding is that because we have so many deaths in terms of maternal mortality, that there's bias, and that there should be bias training for everyone that comes in contact with a woman of a different culture, of a different race.
Yeah.
And make sure that there are checks and balances within that hospital policy that's monitoring those kinds of things.
I get so emotional. I'm like literally emotional right now because I remember watching that video back. And I also remember the one that they had to have the baby on the side of the road. And for somebody who has not had a child yet, it makes me extremely scared, even though I know that everyone is not the same. All people in the healthcare industry are not the same, but it does make me extremely scared. And I know it makes other people out there extremely scared because of these different biases that we're seeing, not just in person, but like online, worldwide, basically. And it's like, it's not just happening here in Louisiana, it's happening all across the United States of America. So it's like, what do we do as individuals? Like, I know that we talked about advocating for ourselves. I know that we talked about that, but what is there? Is there an organization for Black medical people to come together to talk? I don't even know how to say it out loud, but yeah.
Well, like the National Black Nurses Association actually has a maternal task force.
Okay.
Louisiana has a task force that they pull together physicians, and it's led by a Black physician, a female physician, and they've done some work in trying to change, what's happening with terms of maternal mortality in our state. But one of the things, another recommendation is to bring somebody else with you, to have a support person, if at all possible, that can hear the conversation. And if you're in pain, that person can understand better than maybe you can. But there's always good to have somebody with you in those situations when you're going to deliver your baby. And another thing is doulas. I'm not sure if you've heard about doulas.
I have heard of doulas, yeah.
Doulas are not medical people, but they have been trained. They're somewhat lay people, and they're different categories, but they've been trained on helping facilitate the process, and they'll work the delivery process, and they usually work with mothers from the point that they find out they're pregnant to after the baby is delivered. And so it's like that support person that can help you throughout the process. And if you're having these unusual feelings, they'll can be able to explain it to you. And if that person can go with you to the hospital, to your delivery, that's great. Some hospitals don't allow them to come, though, and so you have to be, mindful of those kinds of things. And the other thing is never be afraid to speak up and to say, okay, I appreciate what you said, but can I speak to someone else? Because I don't feel like I'm getting the care that I should get. And, we have to be confident enough to say those kinds of things.
What message would you share with Black women about taking care of their health?
Well, I think what I'd like to say is, we've talked about it before, but just to go back through that, is to know your numbers, prepare for your appointments. When you have a doctor's appointment and you're going for a specific reason, write down some questions that you'd like your healthcare provider. And I'm saying healthcare provider because we see physicians now, we see nurse practitioners now, we see physician assistants now. So know who you're seeing, know who you're seeing, and be prepared for appointments. Speak up. Your voice really matters. Let them know that I'm interested in my health. I'm not just here just to be coming and just to get a pill because I have this condition. I want to understand what's going on with me and how to prevent it, what initiated, what caused it, and then how can I prevent it from happening again. Yeah. Bring support. We talked about that. Even when you're taking your loved ones, your parents, are going to the doctor, it's good to have somebody else there that can ask questions as well and listen to what is being said. And to stay informed about your health, conditions that impact Black women, and things like we've talked about, blood pressure and diabetes and kidney disease, and know your numbers. And here I want to add, I wrote this: remember, caring for your health is not selfish. And that's the key. It is stewardship. Rest is worship. Eating well, moving faithfully, and advocating for your health are acts of God, honoring God's temple. So taking care of your body is really honoring God's temple, because he has much work for each and every one of us to do in order to bring his kingdom here. And so we want to be in the best health possible. And so knowledge, advocacy, and faith, I think, are the key things that I would like to bring to women and women to be aware of.
All right, y'all. So we at Black Girl Vitamins do a scholarship for Black women that are in the medical industry, that are students. And so this is going to be our last question. I just want to share any advice that you would have to students, Black women who are striving and out here in the same shoes that you were in, because you were once a student before you became who you are today, the fabulous woman that you are today. And so what advice would you give to students that are on their journey to becoming RNs, who are on their journey to just be in the medical field, doctors, or what have you?
Well, one of the ththings, I belong to the Acadiana Black Nurses Association, that's through Lafayette. And I just want to give a shout out that we're creating a Black Nurses Association here in the Baton Rouge Greater Metropolitan area. And one of the big goals of our organization is to mentor young people, that are interested, that are in nursing school. And so I've worked with students, students that I've had the opportunity to teach while I was at Southern, are now my colleagues and are working in are part of this organization. But I would say to be encouraged that nursing is not an easy career, but it's a fulfilling career. And getting through your education is key. So putting that time in. And what I found even when I was working at Southern is that many students had to work. And there were single moms as well. So finding that support system that is going to help you as you move forward in your education, and stick with it. Even when times get hard, and you may have, and take that prayer along with you. But there's many students that I've had the opportunity to mentor and to pray with. And years later, I come and I'll see them in a grocery store and they'll say, Dr. Bienemy, you just don't know how much it meant that you just took time just to say a prayer with me, or just to encourage me along the way. So if this is for you, you stick with it and don't let anyone tell you that this is not for you, and you know that God has given you this opportunity. So I encourage you, and I look forward to seeing you as one of my colleagues.
So my girl beat me to it, but we have a superstar in the building right here. She just came from the Big Apple, New York. And we just want to congratulate you because she was inducted into the Academy of Diversity, Leadership in Nursing on Friday, December 12th. So congratulations.
Thank you very much. Thank
You're
you.
So welcome. And on behalf of Black Girl Vitamins, we want to
thank you so much.
Thank you so much for being here and just doing all that you do for the community and just bridging that gap between the inequalities that we see within the healthcare industry. So we really appreciate you.
Thank you so much. I have truly enjoyed this opportunity to speak with you. I think that talking about health is going to really help to improve our health outcomes. Awareness makes a difference. And so knowing people out there that care about us and look forward to making a difference in really decreasing the health disparities that exist in our communities. And it's going to take a while, but you know what I've learned? I've learned that make a difference in your sphere of influence. You may not be able to change the world, but you can change what's around you and those that are around you.
Absolutely. Well, y'all have heard it here. Thank you so much for tuning in to BGV Conversations. We're so happy that you can join us. Don't forget to like, comment, and subscribe, and stay tuned. We got some more videos coming your way. Bye.